Well, good morning, everybody. Thank you for joining us for our press briefing. And we've got a special guest here today, but before we get into that, I want to cover just kind of what we generally cover with regard to the pandemic, to remind people that we want to continue to make sure you're following our guidelines with regard to social distancing, that you keep that 6 foot of distance between you and other people when you're in public, wear a mask when you go to the store or any place when you're going to be like inside closer than 6 feet to people, wash your hands often, avoid crowded bars and restaurants, things like that. All of that will help us make sure we continue to slow the spread of the virus. And of course, all of this is around making sure that we preserve our hospital capacity here in the state. That's the whole reason we do this, is make sure we can provide that hospital bed, that ICU bed, or that ventilator to anyone who needs it when they need it. And right now, here in the state of Nebraska, we've got our hospital bed availabilities at 36%, the ICU bed availabilities at 35%, and the ventilator availability is at 83%. And I don't think we've actually fallen below 70% at any time during this pandemic with regard to ventilators. So we've really been successful here in Nebraska in preserving that hospital capacity. So please continue to remember to follow our good social distancing guidelines. Also, want to remind people to use Test Nebraska, testnebraska.com. You can sign up. We've got over 341,000 people that have signed up for that. We've done over 1 million assessments and have done over 223,000 tests that we've delivered through Test Nebraska. It's making up over about half the tests we do in the entire state. So if you sign up, you can start looking right away to get scheduled for an appointment and get in there and get tested. If you're going to go, say, see a loved one, it's a great opportunity to go get tested to make sure you don't have the virus so that you can go see your loved one. So always a great opportunity there to be able to get that done. So please sign up for testnebraska.com. Also, before we get into the rest of the program here today, I want to just thank all the Lincolnites who turned out to support Investigator Herrera and lined the road for the funeral procession. It was really touching and moving to see all that support, and especially in St. Teresa's Parish. There were just so many people out there. Thank you very much for doing that. And I also want to thank the Omahans who did the same thing when Investigator Herrera's body was being transported from Omaha to Lincoln. Again, really, I just appreciate everybody's great show of support there for law enforcement and for the Herrera family. It was a very, very tough day, obviously, for the Herrera family. We really appreciate everything everybody did. And then also one more thing, I'm sorry I forgot to hit upon. Today, September 14th, we updated our directed health measure. The entire state is now in phase 4. So we had 3 public health departments, North Central, Loop Basin, and Southwest, that were in phase 4 already. Actually, we moved Panhandle into phase 4 on Friday. The rest of the state followed on today. I do want to clarify something that I was not as clear as I should have been. The state has moved all the public health districts into phase 4. Lancaster County has chosen to remain in phase 3 through September 30th. So that is a Lancaster County decision, not a state decision. Just want to make sure that that clears up some of the confusion maybe I created last week when I was talking about this. So everybody has that going. So today we want to talk about our hidden heroes. So this is something that the Elizabeth Dole Foundation has established to recognize those military caregivers. We have 5.5 million people who provide that care to our military members who come back from defending our freedoms and maybe have experienced that injury that then these families have to be taken care of. So it often is one of the spouses who is then making sure they're providing to make sure the kids get taken care of and go to the activities, but also, or maybe the breadwinner, but have to take care of all the legal and financial things with regard to the family, the complex medical conditions that maybe accompany their loved one and so forth. So we need to recognize these heroes in our society because this is a lot of work and it can take a lot of time. And those folks can then start feeling isolated where they are. And then that can lead to depression and deterioration of their health. So it's important that we recognize these hidden heroes here in Nebraska. Now in Nebraska, our goal is to be the most veteran and military-friendly state in the country. With the help of Senator Lowe and Colonel Brewer, thank you, John. Colonel Brewer, we passed LB 153, which is a 50% tax credit on our military retirement benefits for our veterans here in the state. And that is a great step forward to be more competitive, to hold on to our veterans here in the state. But we've also done a number of other things around especially job opportunities for spouses of active duty military. For example, we extended them the same hiring preferences here at the state that we do for our veterans. We've made it easier to get licensing with the Uniform Credentialing Act, with the Nurse Compact, so that you can, if you have a nurse license someplace else, you can use it here in Nebraska. I signed a regulation that allows teachers to do the same sort of thing. They can come here and get a 3-year temporary license. We do that with real estate agents. We do it with attorneys, really trying to help those active duty families to be able to integrate into our communities, to be able to make it more accommodating for those families to move to Nebraska. We've also recognized our military families with 5 new license plates, for example, as another way to recognize our military families. And so today, what we're going to do is talk about what we're doing with regard to the hidden heroes. We're going to be, in a few minutes here, I'm just going to sign this proclamation, and we will be the 4th state to have a Hidden Heroes Proclamation, and there's 156 communities across this country that are recognizing those hidden heroes. And again, this is done in conjunction with the Elizabeth Dole Foundation to recognize those families. Today, we have a special guest with us that is going to be talking about this, and that's Andrea Dorsey. And she is the wife of Joe Dorsey, who was injured in Iraq with an improvised explosive device and has experienced back and neck pain and also the invisible wounds that go along with it, the mental trauma that goes along with being in combat. And so she has worked to be able to find resources to be able to help him both within the VA and outside the VA to be able to manage the injuries that he has received, and of course continues to make sure that they work to continue to keep the family. They've got a couple kids. One of their kids is with us today. Joey is here with us today. So we've got a great family here, and first of all, I want to say, Joe, thank you very much to for your service to our country. We really appreciate it. And I know Joey's proud of his dad and his mom, so good job, Joey. And then also, so Andrea is here to talk a little bit about the challenges that our military caregivers encounter when they're working to take care of their loved one and their families and all the issues that go into this when we're talking about, again, just from getting kids to activities to making sure that their loved one has the proper medical care to the legal, financial, complex medical issues, all those sort of things. So Andrea, would you please come up and, sorry, I got to sign the proclamation first, hold on. I'm getting ahead of myself. Let me get this signed. I'm going to first sign the proclamation to declare us a hidden hero state. Like I said, we are the 4th state to become a hidden hero state. And Andrea, will you please come and accept this as a token of our appreciation for the work that you do? All right, great. Keep that. That's for you.
All right. Thank you, Governor Ricketts. My name is Andrea Dorsey, and I'm honored to be a part of this special occasion and proud to represent the Elizabeth Dole Foundation and military caregivers in Nebraska and beyond. I'd like to thank Governor Ricketts and the Nebraska Department of Veterans Affairs for pledging your support to military and veteran caregivers in our community and signing on as a Hidden Heroes state. I can't tell you how much this means to me and my fellow caregivers. Although our stories are different, many of our experiences and challenges are similar. I'd also like to thank Congressman Don Bacon and his staff, including Dean Mattison, who's with us today. It was very evident during our initial meeting in January that Congressman Bacon was committed to supporting Nebraska's military caregivers. Congressman Bacon and his staff played an integral part of making this proclamation happen. We thank them for being advocates for service members and veterans and their families. Caregivers are spouses, siblings, children, parents, and other loved ones who voluntarily provide around-the-clock care to America's wounded warriors at home. It is the spouse who ensures appointments are made and medications are taken. the mother who stands behind her son as he learns to walk again, and the children who know to pick up their toys so dad's wheelchair can get through. The loved ones who they care for might have physical injuries, such as lost limbs or amputations, or invisible wounds that cannot be seen, such as post-traumatic stress disorder or traumatic brain injury. Caregivers have a host of responsibilities that may include managing medication, assisting in wound care, dressing, bathing, and coordinating medical appointments, providing physical and emotional support, monitoring environmental changes, assisting with other activities of daily living, and so much more. In most cases, military caregivers do all this while assuming responsibility for the entire household, cooking, cleaning, child rearing, and paying bills. Caregiving is a full-time job, and it can be mentally, physically, and emotionally draining. For me, my caregiving experience began many years ago when my husband was injured in an IED explosion while serving with the U.S. Army in Iraq. He returned home with post-traumatic stress disorder, sleep disorders, and head and back injuries that have progressively worsened over the years. As Joe's wife and caregiver, it is my responsibility to help him cope with the everlasting wounds of war and to advocate for his care. I'm incredibly proud of his never-ending strength, positive attitude, and commitment to helping other veterans and their families. Senator Elizabeth Dole shares a similar story. When her husband, Bob Dole, was admitted to Walter Reed Medical Center for 11 months in 2011, she experienced firsthand the tremendous challenges facing the loved ones of our nation's wounded, ill, and injured veterans. This experience inspired her to establish the Elizabeth Dole Foundation and commission the RAND Corporation to conduct the first national comprehensive evidence-based study of military and veteran caregivers. The research revealed that there are more than 5.5 million military caregivers in the United States. These caregivers drop everything to care for their wounded service members and veterans at home, and they are proud to do it. However, in most cases, caregivers begin this journey in total isolation without any support. At the Foundation and through the Hidden Heroes campaign chaired by Tom Hanks, our goal is to shine a bright light on our nation's military caregivers by empowering them, honoring them, and providing them with the resources and support they need and deserve. And today, I feel so fortunate that my state is joining the Foundation and 155 other Hidden Heroes cities, counties, and states across the nation in this important initiative. As a caregiver, I can tell you just how life-changing community support can be. I have met so many amazing people who are able to lend support to our family. My family's hope is that through our work with the Foundation, we can advocate for military families, connect them with available resources, and most importantly, let them know that they do not have to walk this path alone. The needs of military caregivers vary from state to state and community to community, but with support from the Foundation, we can pinpoint those needs and find solutions to the challenges facing the Hidden Heroes right here in Nebraska. Our nation's caregivers are serving our country with the same honor and duty our loved ones demonstrated in volunteering to defend our freedom. It is time our communities embrace them and provide the support and recognition that they deserve. My hope for today's state proclamation signing is that cities and counties across the great state of Nebraska join the Hidden Heroes Cities and Counties Initiative led by the Elizabeth Dole Foundation and join the other 155 cities, counties, and states that have signed on to the Hidden Heroes Pledge, passing resolutions to recognize, support, and engage military and veteran caregivers in their communities. As the Dole Caregiver Fellow representing the state, I can't wait to work with each community to reach and recognize veteran caregivers and our unique vital service to our nation. Finally, as we celebrate the signing on, I encourage you to reach out to the caregivers in your life. Take a moment to show your support and let them know how much you appreciate all they do. Thank you.
Well, thank you very much, Andrea. We really appreciate it. Great role as being involved with the Elizabeth Dole Foundation and all the other roles, all the other hats that you wear, you know, being wife, mom, chauffeur, teacher, right? You're a teacher, so thank you very much for that as well. All right, so next what I'd like to do is call up John Hilgert, who is the director for our Department of Veterans Affairs, to say a few words about this as well. John?
Thank you. First of all, let me thank the governor and for his leadership. There's been so many accomplishments regarding advancing the care for our veterans and their families, and this is just another one of them. Today's proclamation lays out several steps that the Nebraska Department of Veterans Affairs is taking to acknowledge and assist the family members, friends, volunteers, and professionals. The first step is what you saw today, becoming a Hidden Heroes state. Nebraska, as you've heard, is the fourth step, making this pledge. I'd also like to thank Congressman Bacon's office as well, working with Dean Matisse and his staff, making those concepts that are in the nation. And I first heard about Hidden Heroes in D.C., making those D.C. initiatives relevant to Nebraska. Thank you very much for doing that. I'd also like to frankly thank the Dorsey family for coming forward and sharing your story to make it so much easier for other military families, their caregivers, and our veterans to come forward and seek the help they need, and knowing that in America and in Nebraska, they're not alone. At the Nebraska Department of Veterans Affairs, we've already launched a new webpage on our website, veterans.nebraska.gov/Hidden Heroes. Go to the website, search Hidden Heroes, you'll find it. And you'll find a lot of information there regarding Hidden Heroes, what you can do as a caregiver, what you can do, access help and services as a veteran. If you're an employer, there's also activities there, the sensitivity that you might have, maybe flexing the schedule of a teammate that works for you to accommodate the type of care that caregiver is giving. Lots of resources there, lots of resources. We've trained staff in the Nebraska Department of Veterans Affairs to be able to take the calls, to have that awareness, to plug in individuals who are family members, and then also individuals in our state that wish to support those families. There's a role for you too. This is applicable to all Nebraskans that care about our military and our families, that are military families. For example, someone who is caring for a veteran, a military family, may would like to have some respite, maybe would like to have help going running some errands. Every situation is very unique and very different. There's an opportunity for all Nebraskans to participate and support our Hidden Heroes. We'll also be hosting an annual observance. It's hard to predict what that may look like, but with our national health emergency continuing, but we want to make sure that it's something meaningful. We want to not only recognize our military caregivers' sacrifices, but we also want to connect them with the resources and the tools that are out there, either from the state or the federal level for that matter. This event will also help in the final goal of this program, which is to raise awareness throughout the state of the unique challenges. Our military service members make a huge sacrifice. They are the heroes that protect us day in and day out. Alongside them are the Hidden Heroes, people like Andrea and Joey who serve in their own way and make their own sacrifices. Through this initiative, we hope to better serve them and to tell their story and to give them the care and the support that they deserve. All Nebraska supports you. Governor?
Thank you very much, John. Okay. So what else do we have? Upcoming schedules, got my monthly radio call-in show today at 2 o'clock. And just for those of you who don't know, this is the longest running radio call-in show in the country, over 25 years. So a number of governors have kept this going to be able to allow people to be able to reach out and talk to the governor. And then Monday will be our next press briefing on the 21st here in this room. And actually, this says 2 p.m. Is that right, Taylor? It's going to be here at 2 p.m. It'll be an afternoon press briefing, so it's a little bit different from what we're doing. And then actually later this week, we're going to be doing a livestock-friendly announcement. So that will come later in the week. All right, so with that, Taylor, do you have questions that were sent in?
Yep, Brian from the Lexington paper, he wants to know, with nearly all of Nebraska now under phase 4, he's hoping to inform his readers about what the next step is after
Right, so the question comes from Brian at the Lexington Clipper with regard to, with the state moving into phase 4, what will be the next step after phase 4 and when might we move into that? So the next step after phase 4 would be no directed health measures. So going back completely to no restrictions, the way we were pre-pandemic. And getting there is going to be difficult to predict. It will be something when we feel the emergency has ended, that's when we will lift those restrictions. So I can't give you a specific timeline on when that would happen, but it'll have to do with conditions in the state and the country with regard to where we are in this emergency.
WWT submitted a question as well. Emily wants to know, with phase 4 now underway, we can have 100% capacity at outdoor venues. Does that mean that schools will be allowed to have 100% capacity for sporting events?
So WWT, Emily wants to know, with the state moving into phase 4 and outdoor venues, so I should have explained that a little bit. With regard to phase 4, outdoor venues will go to 100%, indoor venues will go to 75%, and will now schools be able to have full stadiums with regard to their sporting events? And the answer is yes. However, if there's going to be more than 500 people in most of the state, you have to have that plan worked out with your local public health department and approved. So you still have to submit a plan. You still have to have it approved by your local public health department on how you're going to mitigate the spread of the virus. So while the capacity is at 100%, there still has to be a plan in place. It's 500 through people throughout the entire state. The exception is Douglas County, where that is the requirement for that plan is for events with 1,000 people. So that is still in place with regard to our directed health measures.
That's all I got.
And that's all he's got. Yes.
Do you agree with Lancaster County's decision to stay in phase 3 while the rest of the state goes into phase 4? Did you have a conversation with city officials about that?
So the question was, did I have a conversation with the city officials with regard to them staying in phase 3? Again, because Lancaster County has a special carve-out in the statute, they're able to do something separate without getting the approval of the state to do it. So they made me aware that they were planning on doing it, but we did not have a discussion on the merits of it. So but obviously that was Lancaster County's decision to go forward.
But you're okay with that?
Well, it's statute that they can do it. So I disagree with their process. I think we're ready to move into phase 4 across the state, but the Lancaster County gets to go do something separate.
What do you say about the, we had a story and a UNMC expert said, we haven't really crushed the curve, it's just simmering right now. The virus is still out there, it's still active, we haven't crushed it yet. Can you comment on that?
Sure. So there was a story that Paul's referencing about UNMC officials saying that, hey, it's still simmering here. We haven't crushed it. What do I think about that? And actually, that term simmering is really some of the terms that the folks at UNMC used back in March about how this would go, that your whole goal is to make sure that you flatten the curve so that you don't overwhelm the healthcare system, but there is going to be an amount of virus transmission in our society until there is something like a vaccine to be able to address it. And we're at that stage right now where we're just managing the virus. And so we're allowing people to be able to go back to a more normal life. We're implementing the tools that epidemiologists use every day to combat all sorts of outbreaks, which is test people, get folks who test positive to isolate, quarantine people who are close contacts, and that way you can focus on the people who have been directly impacted and allow everybody else to go back to a more normal life. So we're going to be continuing to manage this, and that's just kind of the state we're in right now, where people have to continue to remember to keep that 6 foot of distance, wear that mask when you go to the store, wash your hands often, avoid crowded bars and restaurants. We're just going to be continuing to manage this as we go forward here into the fall.
Do you think there's a risk that the virus could increase now that you've got some of the DHA?
So the question was, do I think there is a risk the virus could increase? And I think what will probably happen is it'll still continue to go up and down, just kind of like we've seen over the course of this summer. So, but again, this is where we want people to remember our good social distancing rules as we continue to manage this virus throughout it. But I think that's what we're doing, we're managing it. So we want to take appropriate steps to allow people to go back to that more normal life, to do some of the things we've been doing before, but be mindful that as we do this, we want to take those steps to be able to slow the spread of the virus, all with the goal of making sure that we're protecting our hospital capacity. And of course, we're taking steps in other areas as well with regard to, for example, long-term care facilities. The Trump administration is sending out rapid test point-of-care machines to the nursing facilities here, our skilled nursing facilities here in Nebraska. It's about 188 of them, and about half of those machines have been delivered. That will allow them to test their staff and their residents, and so that's another step to be able to help protect those folks. We've had a program in place here at the state for about 4 years called the ICAP program. It's the infection, thank you, because you do it too, right? So Infection Control Assessment and Protection Program. And this actually starting 4 years ago was really teaching folks in our long-term care facilities how to slow the spread of and prevent infections just in general. And of course, those tools work for coronavirus. So just a couple of examples of some of the steps we're taking to be able to make sure we're protecting our hospital capacity, some of the at-risk groups we have, and then allowing people to go back to a more normal life. Yeah, Andrew.
Governor, there was a lawsuit challenging Lincoln's mask mandate, and I guess over the weekend there was a patron that punched out a security person for being asked to put on a mask. How much do you worry that people and businesses are at their breaking point?
So the question was, there's a lawsuit challenging the mask mandate here in Lincoln, and apparently there was a physical altercation when somebody was asked to put on a mask. And, again, this is where we want people, this is one of the reasons why I'm not in favor of mandates, where we really have to educate people around why they use a mask and what the appropriate time to use a mask is. And just, it's one tool among all the tools that we have, like the 6-foot distance, like washing your hands, like avoiding crowded bars and restaurants. All those things are tools to be able to help us control the virus. And it is, I know people are tired of this. I mean, I get it. I'm tired of it too. We just have to continue to practice our good, use our good tools that we have to be able to slow the spread of the virus here in the state, to be able to continue to manage this. And again, continue to leverage all the pillars that we have as part of our plan, the testing, the contact tracing, quarantine space, the personal protective equipment we're providing to everybody, making sure that we've got these plans in place around long-term care facilities, and of course our directed health measures are the sixth pillar of all those things. All those things work together to be able to help slow the spread of the virus here in our state. Yeah.
What was your response when the Nebraska Supreme Court had shut down the ballot initiative for medical marijuana?
So the question was, what was my response when I've heard that the Nebraska Supreme Court had ruled that the medical marijuana ballot initiative had violated our state law with regard to ballot initiatives, and I appreciate the decision of the Supreme Court in making sure that they have to follow the rules like everybody else does to be able to have a ballot initiative. And as it's well known, I am in opposition to having marijuana here in our state. There's no such thing as medical marijuana, and this was not something that was going to be prescribed by a doctor or distributed through a pharmacy. It was going to be done through dispensaries. And what we've seen in other states where this has happened, it has led to recreational marijuana. And of course, marijuana is a dangerous drug, and it can lead to very dangerous side effects like schizophrenia and psychotic episodes. So it's a drug that has to be managed through the FDA to be safe and effective, and that's the process it should go through. Yeah.
I'd also like to go back to Officer Herrera's funeral this past weekend, some remarks that you made. I'm kind of wondering why you thought that was an appropriate time to tell that audience you were speaking to not trust what the media says and what they put out there.
So the question was going back to Investigator Herrera's funeral, when I made some comments about to law enforcement officers, don't believe what you see out there in the media with regard to people not trusting law enforcement. I travel the state of Nebraska end to end. Nebraskans support our law enforcement. And I wanted to make sure that message was loud and clear to our law enforcement officers because, look, the media will tend to take things and, look for the controversy. But that's not what we necessarily see here in Nebraska, and it's certainly not what the vast majority of Nebraskans believe. They believe their law enforcement officers do a good job. They want to make sure that they're supporting them. And we saw that with the number of Lincolnites that came out to line the funeral procession route. We saw it in Omaha when Investigator Herrera's body was being transported to Lincoln. Nebraskans support our law enforcement officers, and that's the message I wanted to get out.
Do you believe that our local media outlets don't trust local law enforcement?
So the question is, do I believe that our local law enforcement or local media don't trust law enforcement? Support, okay, support. No, really, it was getting at to, look, what happens just in general, right, is that you always hear the bad stories, but the good stories don't get reported often enough. And so I think that because the bad stories are more controversial and they're out there more often, I wanted law enforcement to know that, hey, I know what you see out there in the media, but let me tell you, the vast majority of Nebraskans actually support you.
You want to comment on the environmental trust? There's a group called the Friends of the Environmental Trust. They put out a press release last week. Among other things, they said the trust board may have approved some grants without majority votes, if there might be a legal issue with the decisions of that board. Can you comment on that?
So there was a group called the Friends of the Environmental Trust, and they said some of the boards, the Nebraska Environmental Trust, made some votes without the majority of board members, and so may not have been following their procedures. I can't talk to that. To my knowledge, that is not true. I will tell you that the Nebraska Environmental Trust has done a great job in promoting a number of different issues, including ethanol, which does help clean up our environment. Ethanol cleans burner, helps clean up the air, and so that is an environmental issue and is perfectly appropriate for the Nebraska Environmental Trust to take up. That's an environmental issue.
Sure. At least their group questions that. They said it's more for private gain than public gain.
Excuse me?
They said that the approval of ethanol pumps, which could be purchased by the private gasoline station owners, is more about private gain than public.
So this group was saying that the ethanol grants that were given out were more for private gain than public gain, and I think that having clean air is a public gain for everybody. Everybody wants to have clean air.
And at least one person here said that questioned whether you were applying political pressure, that she wasn't appointed to the board because she disagreed with you on an issue. Can you comment on that? She wasn't.
I don't even know who you're talking about, Paul.
Mary Lorenzen.
Oh, what about her?
She
So,
wasn't reappointed. She says she's concerned about political pressure because you guys disagreed on an issue. I think it was conservation easements.
so Jerry Lauritsen was saying that we disagreed on an issue, and I had conversations with Jerry about it. And again, as governor, it's my prerogative to appoint people who are going to be on all of our boards and commissions that are going to promote things such as property tax relief, and we had a disagreement on that. And so after our conversation, we decided that Jerry wasn't going to be on the board and that I would appoint somebody else.
Would you say it was political pressure?
As governor, I was elected by the people of Nebraska to promote things such as property tax relief. And it is well within my prerogative to appoint people who are going to promote things like property tax relief.
And what is your opinion about conservation easements?
And so the question then gets directly back to conservation easements. And while I believe that conservation easements are a tool, just like any tool, it can be overused. And specifically, when you're talking about easements into perpetuity, I believe that limits too much the ability of any future policymaker to be able to put good policy in place. So long-term easements that are maybe even 99 years long, I think are appropriate, but indefinite easements, I believe, are bad policy.
Isn't that a landowner decision? How would a policy owner, policy director, or policy person?
So if, again, it would be whether or not the state was actually going to be supporting indefinite easements. Like, is the state going to use state resources to support indefinite easements? And I don't believe the state ought to be doing that. Andrew.
Governor, it seems like for months you guys have been managing the situation at the penitentiary and the DEC, pretty well. Have you been able to figure out, been explained why all of a sudden you've got this outbreak that's going on?
So the question is, Department of Corrections, and specifically within our corrections system, we've been relatively lightly impacted with regard to the spread of the coronavirus up until recently, where I think we've got now over 50 cases or so. And the question is, have we figured out why? And I don't have an answer for you, Andrew, other than this is a virus. And again, this is one of the things that we've said many times in this room. You can't stop it from coming. What you can do is just mitigate against it and make sure that you're taking all the steps to do that, to be able to and provide that medical care for anybody who's severely impacted. So we're certainly going to take additional steps to mitigate it within our correction system. But at the end of the day, this is a virus. You can't stop it from coming.
Are inmates less, are they wearing masks less, or are they adhering to the mask wearing?
So again, when it comes to the inmates' behavior, a lot of it's got to be voluntary. We try to do the same sort of thing with them as we do everybody else, try and teach them the rules about 6 feet of distance, wearing masks and so forth. But they need to adopt those rules. And I don't know that not wearing masks is the reason that we're having the spread there in the correction system. Again, it's a virus. It's going to come.
And we were already stretched with, staff members, availability staff members. Do you have contingency plans if all of a sudden we don't have enough staff to man the prisons?
So the question was, obviously, staff have been impacted, and do we have contingency plans with regard to staff who get infected and making sure that we continue to run the correction systems? And, Director Frakes has a plan that we've referenced in the past here with regard to how to manage this. In fact, he's had a plan, not specifically for coronavirus, but in general for what you do with these types of outbreaks for 5 years. So we've had a plan in place for a long time, and Director Frakes is working that plan right now with regard to how we manage this specific outbreak with regard to coronavirus. And of course, we're going to make adjustments to it as we learn things and try things to be able to make sure we slow the spread of the virus. But we've certainly got contingency plans in place.
And does that include, possibly using National Guard or State Patrol?
So the question is, does that possibly include National Guard and State Patrol? And again, one of the reasons we haven't disclosed all the details of the plan is to help make sure we're protecting the, keeping security condition or security concerns in place. So we're not going to reveal the details of the plan. Yeah, Paul.
Can you help me understand, how does property tax relief come into play when you're appointing somebody in environmental trust?
So how does property tax relief come into play when you're talking about Nebraska Environmental Trust? And it gets back to the issue of easements and whether or not those properties come off the tax rolls permanently or for a limited period of time.
They don't come off the tax rolls, they just pay taxes based on, that's gonna continue to be farmland or timberland.
Well, actually, Paul, I actually think some of those property taxes do get reduced or eliminated depending on what happens with that easement. Yeah, Andrew.
And with the Big Ten thinking about, reinstating fall sports, with Lincoln's numbers shooting up, why do you think we're still in a good position to argue that we're prepared to open up fall sports here in Nebraska?
So the question was, with Lincoln seeing an increase in cases, why do we still feel like we can do fall sports if the Big Ten were to allow something like that? And again, it gets back to what we've said all along with regard to this is about managing our hospital capacity. And if you look at the hospitalizations here in Lincoln today, we're below where we've been in the past. We've still got plenty of hospital capacity, and as I think the public health director here, Pat Lopez, has said, a significant percentage of the people who are hospitalized here in Lincoln are actually not from Lincoln. And of course, one of the things we also know is that if we are able to link these cases to, say, university students and take the steps to mitigate that, that also gives us confidence that we can control this. So again, at the end of the day, this is about making sure we're protecting our hospital capacity and then allowing people to return to a more normal life.
And you saw the university's announcement of their rapid testing. How much of a factor do you believe that plays into allowing this to move forward?
So the question was, the university is going to be doing rapid testing, and does that help us move forward? And the answer is absolutely yes. Again, it gets back to, how do you manage any sort of outbreak of a disease like coronavirus? It's about, testing and contact tracing, getting people to isolate and quarantine. That's the blocking and tackling of how you manage these things. And so the more that you can do testing, the more that we can find those people who are infected and keep them away from everybody else. That allows everybody else to go back to a more normal life. Any other questions? Yes?
Would you guys mind going back up there and holding up the proclamation one more time?
Sure. Andrea, do you want to bring Joe and Joey up too? Joey's a veteran at this. Oh, one more, I got one more. Joey, I told you that already. One thing you learn about being governor is always one more picture. Oh, we're gonna take an official picture with that? Okay, great. All right.
Thank you.
Great, thanks. Thanks, folks. Appreciate it. Next week, 2 o'clock. Ryan, you gonna move this? Don't go anywhere, Joey. We're gonna take one more picture.